Okay, so let me begin by introducing David Hall. David Hall is the CEO and CCO, Chief Community Officer at TAMP Inc. David A. Hall is a former medical center admin with masters in Healthcare Administration MHA at Indiana University and Asian Studies, MA at Harvard University, as well as Washington, DC. Harvard Fellowship in the Office of Honorable Lee H. Hamilton. David performed several years additional studies in Management Information System and Information Technology, that is the MSIT programs, is a project management professional with dozens of technical certificates. David has held Fortune 100 and Fortune 500 management positions, adjunct faculty positions at universities in China, co-founded or helped to build at least 10 startups, including the first fintech, first AI, and first e-commerce companies. He has coached, mentored dozens of other startups and has found time to travel to 45 countries. His investment, technology, and consulting firms have worked for years to help develop and integrate emerging technologies, and have also helped raise tens of millions of dollars for health tech, MedTech, and biotech companies. David is currently the co-founder and CEO of TAMP Inc., where he's leading a team to build a global community of doctors and SuperApp platform ecosystem for wellness. TAMP is also a partner for the summit today, and we're working closely with David on his TAMP initiatives. We are very thankful for having him over as one of our speakers today. David, I hope you can hear me. I'm not sure you're on mute.
Yes, okay.
Yes, I think you can share your screen. Thank you so much for taking the time out today for us.
Thank you. It's so wonderful to be here. Thank you very much, Rashmi. Okay, so this fits in nicely with the previous speakers' talks because we really bridge the gap where we've talked about a lot of complex systems. We had Dr. Lee talk about AI, healthcare. We had Dr. Sasahara had talked about some doctor entrepreneurs, and also Dr. Munaswamy. Really enjoyed your talk. Talked about these, really bringing together, and we focus on the human. We focus on the doctor element. We call it the fourth culture doctor, and it kind of brings in all of these areas that we've been talking about. And I've worked both in the technology, as you've heard, and both in the non-technology, both the hard skills and the soft skills. And we are now working on this disruption that's taking place in the new norm. And we focus on this fourth culture doctor, which is a part doctor. This is part artist, part entrepreneur, engineer. So we have surgeons and engineers. We also refer to as surgeoneers. Technologists and scientists. So we've heard a lot. We had a lot of the doctors here today who I would also call the fourth culture doctor. Now I coined this term, and it came from a book that I read around 1995, actually, called The Third Culture. Now this is not really another stage in that book, but it was the inspiration. That book was about the new scientist becoming kind of the new intellectual. Before we had the called the literature, the writer, the novelist. And this was a change. We had the scientists, like the father of artificial intelligence, Marvin Minsky. You may have heard that name. He was my neighbor in Boston. So this book was interviewing these scientists that had become this new third culture. I was inspired to coin this term, the fourth culture doctor, and truly believe this is a movement. We've worked with hundreds of doctors. We've gotten design feedback. We've performed design thinking interviews with many doctors over the years. And this was developed based on those conversations and based on the pains that they are having. So these doctors really kind of have to be all things to all people. So they say, you know, how can I keep my head above water, learning all of the medical knowledge when I need to be all of these different things, the artist, the engineer, the technologist. Not only that, they have to evolve a mindset. So they are evolving a mindset, which is like valued. It's in the flow. There's a program that I went through called the Flow Genome Project. Some of you may have heard with Stephen Kotler. So the idea of flow is not new. It's been around for many decades. However, this is something that everyone really needs to evolve this mindset. One of synergy. So that's working, you know, horizontally and managing and leading horizontally, not just in a hierarchy, not just from the top down. Being collaborative, collaborating with diverse groups from around the world, like we're doing here today, and recombination and synthesis. So I believe this is a very important part. Over the years, over the decades, we've gone through phases of discovery where everything that could be discovered had been discovered. We've gone through phases of experimentation, kind of in the US we call the Thomas Edison. So they, you know, experimented at 10,000 times to come up with the new innovation. Now that no longer works. We've seen with the technologies here today that we require new thinking. We require this fourth culture doctor to recombine and synthesize diverse ideas in order to emerge. So we say new innovations will emerge out of this recombination and synthesis of new ideas. And let's look at what we've discovered over many years working with hospitals, clinics, healthcare institutions, and literally hundreds of doctors. We have 35 doctors on our team that we talk with almost daily, advisors. And we've identified three main areas. Now, there are a lot of areas of pain, and we say pain. Why do we say pain? A lot of people have trouble with that word. They want to say issue. I have an issue, or I have a problem. Perhaps they think pain is too big, or it's too painful to say. But the reason we say pain, we use the design thinking term pain because this is a human emotion. We want to put the human, and in this case, the doctor human, at the center of everything that we're doing. We've identified three areas: unreliable content, digital complexity, and global competition. Now, there are many other pains that emanate, as we had heard from some of the other speakers, even you know, doctor stress, doctor burnout, because we've got all of this complex technology, all of these complex systems. You know, there's issue of doctor burnout, doctor stress that may emanate from these. So let's begin with unreliable content. This includes, you know, doctors searching on search engines. It includes video sites. So there are studies done showing that only about 20% of doctors in one country were reading journals now. 90% were watching videos. And some doctors are maybe, you know, watching a video on a popular video site to kind of brush up on their techniques, you know, maybe right before surgery even. And of that video site, there were studies done of that video site that showed only 6% of those videos could be determined as being, you know, verified, vetted, legitimate. They didn't know who posted the video. Was it a doctor? Was it even a healthcare institution at all? So we have the unreliable content. That's videos, you know, that's search engines. As we all know, you can search and get anything, but you can search and get anything. This is not quality, curated, vetted content. Also images, we now have deep fakes and other images. It's unreliable content. Digital complexity. So the digital complexity has simply, it's simply gone above the doctor's human capacity. So we like to say that, you know, the AI that you're seeing, there was some talk about, replacing doctors or doctors being left behind with emerging technology. So we like to say that the AI or the emerging technology won't necessarily replace doctors, but doctors enabled with or augmented with emerging technology will replace doctors that are not. So the digital complexity has just exceeded the doctor's human capability right now. Global competition, there are different aspects to this. We have medical tourism, so we have some doctors traveling, or they were before this new norm. Now it's omnipresence with telehealth, telemedicine, as we're doing now here on Zoom. There's a shortage of doctors. So some areas you have doctors that we have talked to say there are too many doctors. In other areas, there are not enough doctors. And now with virtual reality, augmented reality, remote robotics, telehealth, telemedicine, that's changing as well. On the average, there's a shortage of about 4.3 million doctors globally. So these are the main areas of pain that have been accelerating. We say, as Ray Kurzweil says, the acceleration is accelerating. Before, we were at an inflection point of exponential growth, and now that has sped up with this new norm by several years. If you look at Zoom that we're on now, last week they announced their profits had doubled. So it's twice the profits just last week. So why do we need this fourth culture doctor now? Why are they evolving? And it is a series of things that have converged, that have come together, such as technology, the convergence, all the technologies that we saw here today, that we see every day, convergence of 5G, virtual and augmented reality, VR, AR, extended reality, mixed reality, XR, MR, artificial intelligence, Internet of Medical Things, IoMT, blockchain. All of these have now converged to make this possible, and to make the fourth culture doctor possible. And I might add also, historically, doctors have always been innovators. Doctors we see as the leaders of this fourth culture doctor movement, as they've really been throughout history. And there's a content explosion. As I mentioned, there's a lot of unreliable content. There are, we know, more books published every year than were written in the history of mankind. Safety, security, privacy issues, ubiquitous mobile phones. We have something like 3.5 billion smartphones. We're adding several hundred million new mobile phones every year. For doctors, about 90% of doctors have a mobile phone, and they spend about 2 to 3 hours a day on their mobile phones, searching for information, looking for medical information, watching the videos that I had mentioned. And also the customer experience is putting a lot of pressures on the doctors. So customers demand, customers are also getting more information, but they're also getting more information, misinformation as well, from many of the same places that the doctors are getting it online. And those clients or patients are coming in, they're demanding more personalization, more customization. The doctor might be thinking, what is my rating going to be online? Am I going to be seen as this fourth culture doctor? And we're developing a smart clinics plus smart labs and certifying these fourth culture doctors. So when the client comes in, it improves the communications, it improves the outcome, and also, from a social media standpoint, the client and patient, they're demanding this technology, and they feel that they have received the best care possible. They're going to give a higher rating, so they're demanding it. So just want to talk about some of the solutions, and then during the Q&A, I will stop that there. During the Q&A, I'd like to get your feedback, like to get some ideas, maybe some fourth culture doctors that you've met, some examples that maybe you can provide, some of the solutions that we've come up with over the years. are developing what we call real life experiences library. So if you look at medical schools, the way of learning through textbooks, left to right, to put the text into our heads, or 30 medical school students, kind of trying to look over someone's shoulder to learn, is very outdated. And so we need what's called real life experiences. We need doctors sharing their knowledge, sharing their expertise. As I mentioned, doctors have always been the leaders, and we believe now during this new norm that the doctors can continue to be the leaders and the innovators by sharing their knowledge, but perhaps they haven't done it as much in the past. And why is that? Perhaps they didn't have the right platform. They didn't feel that it was for educational and learning purposes. Maybe they didn't want to share it on social media. They're looking for a platform that's safe, secure, with vetted content. It's professional. It's for educational purposes. So this what we call the real life experiences library, we believe, is one of the biggest things that doctors can do, is share that knowledge and expertise that they've built up for many, many years. They've built it up, and we want to capture that and provide that throughout the world so that we can help many more people. Some of the other, I've got a kind of a top 10 list. Change management is very, very important. So doctors say, I can't keep my head up above water. How can I still innovate? How can I still implement some of these things? How can I do these? And we suggest something like a dual processor, like a computer, dual processor model. This comes from Dr. Cotter at Harvard Business School, HBS. There's a book called Accelerate, XLR8. We say, you can do business as usual on the left, and then you innovate on the right. And some ways to do that are, there 1 in 3 doctors are independent. 2 of 3 doctors, maybe are employed, work for hospitals. So there are different ways that they can do that. The independent doctors can work together with technology companies, with AI companies, virtual and augmented reality companies to co-create, because those content providers, they need the expert knowledge because content is king. So they have the hardware, and a lot of times they're developing content they think is necessary, and then maybe pushing that out. They have to design together with the doctor. So there's a big opportunity there. AI hackathons, artificial intelligence hackathon. Dr. Lee was on here. He runs one at Taipei Medical University. I was a mentor and a coach at the AI hackathon. We had groups of people from all different diverse walks of life, 5 to 10 people. And doctors don't need to have AI knowledge. We do have some doctors that can program in AI and Python and other languages, but they can participate because they have the medical knowledge. Then we have some people on the business side. We have some people on the programming side. So they're working together as a diverse team. There was some mention of the millennials, adopting more easily, adopting the technology. And a lot of the senior doctors are getting that technology and access to that from the fellows that are coming in. So we have the younger doctors, the millennials. We have multi-generational. So we have the doctors in the middle, and then we have the senior doctors. Doctors in hospitals can join. Many hospitals have initiatives such as simulation, medical simulation, VR, AR, and other programs in their hospitals. So I encourage the doctors to join. And also, if we have other medical professionals, nurse practitioners, physician assistants, and others as well, to get involved. And we are expanding from the fourth culture doctor to include those other medical professionals as well. We believe that's very important. Soft skills. We were a learning and development. We were a company, executive coaching company for many, many years. So we customize for healthcare, for doctors, especially, such as soft skills, such as communications now become doctor-patient communications, such as SDM, shared decision-making. And we have partners that provide, they have avatars So the doctors can communicate with a virtual avatar and practice, 15 minutes a day, practice their communication skills with these new types of clients and new types of patients that are armed with this information. And so they need to communicate with them differently. And we can use the technology there as well. Doctors becoming service providers. So it used to be just kind of a one and done. It used to be trading time for money. Now it's 24/7. Doctors, there was some talk about Fitbit. There was talk about wearables, how, the Fitbit wasn't really, a healthcare wearable, where we can have clinical grade, hospital grade, healthcare grade wearables that the doctors can work together with their patients to monitor, and then there can be a subscription fee. So doctors can generate revenue, generate additional source of income, which is very important in this new norm, because we've got many clinics down 70%, some clinics have closed. And so the doctors can have new innovations, they can give, they can share, they can earn revenue, they can license intellectual property, IP. So what they're sharing, they can build this real life experiences library, and then they can share that out. So they can be compensated, and this is incentive for them. So this incentivizes the doctors to be able to share what they've learned, their hard work, many years of expertise, and they can generate revenue from that. And we encourage doctors to network. So some doctors have told us, hey, we're not really so social. We want to learn, how to network. We want to learn better networking skills. So, find platforms out there where you can connect, as we're all doing on, especially for doctors, it should be a safe, secure, private doctor platform. Access the technology, get your hands on it. We say seeing is believing. Interact with the technology, and you don't need to change your whole clinic or whole hospital. Get a quick win. Add one IOMT, one medical thing device in your clinic. Design that with one client or one patient. Get a quick win, see how it works, and start. Buy one set of AR, augmented reality glasses, or one VR headset. So we've got a lot of doctors that started that way. And you've got to promote yourself. So there are already a lot of platforms and programs out there about this. But we've heard from a lot of doctors that say, hey, the younger millennials are promoting themselves more. They're on Twitter, they're on TikTok, creating videos. I've seen a lot of now middle-aged or senior doctors doing that as well. So you've got to promote themselves as their own consultant, their own corporation. And art, I will finish with art and medicine. So we have been developing art and medicine programs. Many medical schools now require an art class. And it's not just for fun. These are special art classes that allow doctors to see the client or patient with a holistic view rather than just looking at the symptoms. And we have viewers, we'll get it from India and from Greater Asia and other places. And we know in other parts of the world, doctors may focus in on one symptom or one treatment, where other areas, they may look at the holistic system. We're bringing that together again in this recombination and synthesis, where this fourth culture doctor can have a holistic view, and they can do that through art. And so we're developing online art curation, art customized art classes for doctors to be able to do that. They can bring in new treatments and therapies, because now they've got to kind of be able to look at the client and patient with a holistic view, and also with the treatments. So they might be using many different treatments in their smart clinic, doing a DNA test up front, walking through biomarkers in virtual reality with the client, and then performing, say, a surgery. There are many minimally or non-invasive surgeries now that are available, and then following up with maybe alternative therapies, stem cell therapies, even from different parts of the world, from India, Ayurveda, Chinese medicine, and European therapies as well. And they need to know at a glance from all over the world what therapies and treatments are available, and they need that decision support. And so we believe this fourth culture doctor movement and concept will enable better outcomes and enable doctors to lead this movement. And I will end there and open up for questions.
Thank you so much, David. That was a very interesting talk. So the question is that the fourth culture doctor is a relatively new concept in India. We've not heard of this before. It's possibly the first time we're having a session on it also. So in case, or what are your plans, if you have any, to bring the fourth culture doctor to India? Meaning here we do not have smart clinics as smart as you had explained. I've possibly seen this one dental clinic which had some modern equipment, again, because the dentist was a very young person. We have a few hospitals which perform the kind of minimal invasive surgeries with that kind of expertise. So in India currently, we do not have much of this kind of idea, knowledge, mindset. There is no knowledge about it over here yet. So how can we educate the doctors, basically, that something like this exists, and possibly if there are any consulting services that they would require to learn more about this, also about the side hustle that you were mentioning, so are there any plans from your end, and how can we promote this in India so the doctors know that this is something also that can be done?
Yeah, good question. We're developing what's called a platform ecosystem for wellness, where we bring all of these fourth culture doctor tools together, and we're combining that with innovation centers. We're planning 11 innovation centers around the world, and this will happen very rapidly. So we may not see a lot of this happening right now. However, when this rolls out, it happens very quickly. When you look at, give Apple iPhone or something, when they roll out, virtual reality, they roll it out, to 500 million people or 1 billion people. So we've got this exponential growth. So when you see it, that's why we want doctors to be prepared. And in India, we do have plans to expand to India. We already have a presence there, of course, with our partner AKT Health. And welcome to join us there. We plan events there that are centered around the AMP Doctor platform, and that are also centered around the innovation centers where doctors can learn and they can interact. So immersion is key. Interaction, the way that adults learn, the way that human adults learn and humans learn, is interaction, full immersion. They're able to learn faster and remember a lot longer. And so this is key, but it happens very quickly. So when it does, it will be kind of like a typhoon. And so that's why we need to prepare now, and because it's emerging technology, it's not future technology. It's already happening.
Yes, so I think the need of the hour is to like I said, educate the doctors more, because this is such a novel concept right now. And yes, I think we will work together to